We have been working really hard on this product, so we are excited to get it out to you and get it out to market and show you guys a behind the scenes peek of our new difference benefit admin system. So thank you for being here today. My name is Taylor Britt. I am the Senior Director of Marketing and Sales Media for the Difference Card. I've been with the organization for about 7 years. I get to do really fun stuff like this, put together exciting webinars. I've also got my marketing specialist, Shelby Tyler, on the line. She's gonna help run this webinar. So Shelby, say hello to everybody.
Hi, everyone.
And then we've got a great lineup of speakers today. So Chris, I'm gonna go ahead and pass it over to you so you can introduce yourself to our audience.
Thanks, Taylor. And hello, everyone. I'm Chris Calderon. I'm our Chief Revenue Officer. Been with the Difference Card for over 10 years now. And I have the pleasure of working with all of our sales and account representatives across the country, and excited to display the new Ben admin system to you all today. And Ashley, why don't you go next?
Great, thanks, Chris. My name is Ashley Doobie. I'm the Northeast Market Director. So I've been with the Difference Card now for about 7.5 years. Prior to my tenure here, I actually used to work for a company that sold benefit administration systems. So I'm really excited about this rollout and looking forward to the demo today. Terry, how about you?
Thanks, Ashley. I'm Terry. I am the Manager of Client Success for the East Region here at the Difference Card. Prior to serving in this role, I was an account manager at the Difference Card, and before that, a data analyst on our data eligibility team. So I am very enthusiastic about showing you this awesome solution we have that I believe is going to benefit you as well as your members.
Yeah, Terry, you've really seen lots of different departments at the Difference Card. You know exactly how this all works from an eligibility perspective. And with that, we're really going to start by talking about some of the problems that we've seen in the marketplace and the reason why we are rolling out this Ben admin system for our customers. So one of the problems that we face when we talk to our customers is that there are a lot of manual eligibility problems with the enrollment processes in place. Just a lot of forms that our customers have to fill out, whether it's with Difference Card or really all the insurance companies too. Tons of forms and spreadsheets, and getting those forms right when you're doing things manually can really be tough. And sometimes making sure people are terminated on time. There's a lot of work to do from a manual eligibility and enrollment perspective. And sometimes if there's a mistake, that can create a billing discrepancy. It can cause a claim to get paid wrong. So those are the types of problems we're seeing and the reason why we're rolling out this type of solution. And it's not just about the employer from an HR perspective, but also at the member level. If somebody is enrolled that shouldn't be or terminated that shouldn't be, that causes all kinds of claim payment problems with the insurance companies, not just on the Difference Card side of the house. So this is definitely a problem that we want to try to address with the Ben admin system that we're excited to talk to you all about today. And we want to hear from you too. Is this something you're facing? How many times have you had to resolve some type of billing issue that was related to an eligibility problem? And Taylor, I'll let you roll out the poll there.
Yeah. So we've got a great question for you guys today. We're really curious, like how much are you struggling with getting these billing issues resolved? Is it 0 to 10? Is it 10 to 20, 20 to 50, 50 to 100? Or are you in that very unfortunate category of too many times to count? So let us know if this seems to be an issue for you. Give everyone just a couple more seconds to submit their answer here. All right, let's close it out and share the results. So Chris, Ashley, Terry, it looks like we've got 62%. The majority of our participants are saying 0 to 10, which in my opinion is still too many times, but that's good to know. And then our second most popular answer was 13%, so too many times to count. So we've got some variability there. And then the third was 20 to 50. So lots of billing issues that are having to be resolved out there.
Yeah, especially those with too many times to count, right? That's a big problem. If you've got a lot of billing issues and you're dealing with that, can certainly cause some claim problems, and just getting those discrepancies resolved is difficult. It can be a lot of work in itself. So that's what we're going to talk about today, is how to resolve that type of problem. But I'm going to set the stage one step further, because we're not only going to address the problem of manual processes, billing and enrollment, but also from an open enrollment perspective, this is a great time of year to start thinking about, well, what went right last year at open enrollment? I want to do that again, but also what could I have done better? And the open enrollment and benefits education process is definitely complex. There's a lot of time involved from an HR perspective, scheduling meetings. Employees sometimes have to take time away from their workday to sit through open enrollment meetings that are maybe too general for them. Employees still often have a lot of questions even after open enrollment meetings are conducted. And our team spends a lot of time and energy trying to put together amazing open enrollment presentations. And years ago, they were all in person. We do a lot of traveling and meet everybody in face-to-face and do the presentations. Now we still do some of that traveling, but a lot of it has moved to Zoom or video. And those are great because we can get in front of a lot of people. But the problem is they're very general. We have to talk in generalities. We can't really get very personalized. And sometimes that causes employees to have really personal questions that are not addressed in those big open enrollment type meeting sessions. So this is the second problem we're going to talk about today as we start getting into the solution. But again, we want to hear from all of you about open enrollment and benefits education. How are you communicating benefits to your employees?
Yeah, so this question really came about when we started thinking about our own clients. And we're like, what is the most popular method for our clients to communicate the benefit package to their employees? Are they doing on-site, in-person enrollment meetings? Is it through Zoom, where we all live these days? Maybe it's a series of emails, or do you have a Ben admin system in place already? It's totally fine if you do. We still are going to tell you about ours, but we would love to see your preferred method for communicating the benefits package to employees. All right, looks like we got about half of our participants that have submitted their answers. I'll give everyone just one more second here. All right, so let's share our results. Team, we've got a really interesting mix. 41%, so the majority, are doing on-site meetings. So that's kind of what we're seeing too in terms of our members and our clients. 22% are still living in the Zoom bubble. We've got 27% that are doing a series of emails, and just 10% that have a Ben admin system in place.
That's very interesting. And as we polled some of our customers before we rolled out this Ben admin solution, we looked at how many of our customers had a Ben admin system and were using that as a way to communicate already with employees. And really 75% did not have a Ben admin system yet. So pretty in line with the results we saw there. And very interesting that 41% of you have already come back to doing on-site meetings. So we're going to shift now to start talking about the solution to some of these problems that we've started to address. And the solution comes in a package here, which includes online enrollment technology, an online platform for benefits enrollment. It includes also personalized enrollment decision support. So that means one-on-one, each employee is going to get some decision support just for them. It'll know their salary, their demographics, where they live, their medical needs, and give them some insight into their personalized condition. And there's also an automated COBRA administration system that's packaged into this to try to round out the system and get rid of some of those manual processes involved in administrating COBRA when you have a terminated employee. Really, you should focus on your active employees and let us handle that terminated employee in the whole COBRA system. So this one solution is what we're calling the difference benefits admin system. And we're really talk about some of the details of how this all works. And we're going to show it off live in a demo. So just a little bit more about what the system does. It starts with open enrollment, and it's got this personalized decision support tool so that each employee feels like this benefit package is made for them and they get some actual decision support about their needs. It's also going to collect everybody's elections. So we're going to do that all online using the system where everything goes through the fulfillment center, goes into a database, and then we deliver those elections, of course, automatically back to the difference card if you're already a difference card customer, but also out to all of your carriers. So you might have a medical carrier, a dental carrier, a vision carrier, a life insurance carrier. We will handle those delivery of elections to all of your different carrier partners. So this is not just about medical. It's not just about the difference card system. We're going to handle benefit admin on a standalone basis and be able to communicate with your payroll vendor and all of the carriers associated with your benefit plan. And it is really a full end-to-end system. So if you do have a member that terminates and you have to offer them COBRA, well, we will handle that notification, the collection of premiums. That's all handled, automated in this end-to-end system for you. So what's included? You can do this with passive enrollment. You can do it with an active enrollment if everybody's got to make an election every year. There's a benefits guide that we're going to talk a lot more about, a full communication package where we're reminding employees to sign up for their benefits using the online system, a series of emails. And it's not just about open enrollment. This will work for your new hires. So if you've got a lot of new hires, you're hiring people and you're like, how do I get them up to speed? We already did the meetings months ago. Well, this system solves that new hire problem, change of life events. If somebody had a baby or had some kind of other change of life event, this will handle that as well, collect the documentation that you may need to provide to the carrier for you. And it's totally inclusive of the carrier file feeds, the payroll connectivity. That's all a part of this online enrollment system. So what percentage of employees do not fully understand their benefits package? This is a question that we have tried to help address. And there was an interesting article today in Forbes talking about how 75% of employees don't understand key terms on their benefits package. So just real quickly in the chat, what percentage of employees do you think don't actually understand the benefit package that you all are delivering, right? You're spending a lot of time doing these on-site meetings, email, Zoom, maybe you have a ben admin system. What percentage do you think don't actually understand yet their full benefits package? A lot of high numbers in here, 92%, 80%, 70%. It's actually 50% of employees do not understand fully their benefits package. And again, Forbes today said 75% of people don't understand key terms involved in the benefits. So we definitely need to continue to invest in making sure that benefits education is key and people understand there's a lot of money spent on these benefit programs. We want to make sure that people understand them and really can fulfill them very well. So how do we do that? Well, we're going to introduce you to Danny. And if you're a difference card customer today, you've already met Danny probably in one of our comic strips where we explain how do you swipe the card or how do you get your bills back. Danny is also going to help us through the decision tour of the online system. And we're going to create some animation that will show you. Danny's got a couple of videos to show off, and he will actually take you through the decision support process of making different benefit elections. And the best way to see this is live. So with that, I'm going to turn it over to Ashley and have her actually take you through the member portal and show you Danny live and in person. Go ahead, Ashley.
Great. Thanks, Chris. So I'm going to share my screen here. I just logged in from an employee experience. So I'm sure many of you have dealt with communication issues on how do you communicate the benefits to the employees. But one aspect of that I think that's really important, and I know a lot of you mentioned that you do have open enrollment meetings in person too, is getting the information to the spouse. So having this leave behind system where an employee can log in at any time during open enrollment and then throughout the year to see their benefits, how much is coming out of their paycheck, links to the insurance carriers. This is all a great tool as a leave behind system for your employees. So when I log into the home screen here, I can see the landing page has a little bit about my personal information here. So my new name is Elizabeth. I have my emergency contact here. If I'm currently enrolled in benefits, I can also see a breakdown of which benefits I'm enrolled in. And then if I'm paying for any of these out of my paycheck, it will also have a calculator here. So say I want to go through open enrollment. I know what benefits I'm going to elect, or I just need some guidance on which dental plan I should choose, for example. I would click this Start Open Enrollment button. This is going to bring me to the first page here that's going to ask me to verify my information. So Elizabeth is single on the plan. She doesn't have any dependents. So I'm going to click that this information is correct. Now, here's the Danny, the benefits decision support tool that we talked about. It is optional for the members to go in, but anybody who has a question on the plan, they need to know a little bit more about, say, a health savings account and the advantages to enrolling in one of these. This is a great tool that quickly walks the member through exactly how their benefits work. Anything from medical to dental to vision, and then some of these other pre-tax accounts that we can set up as well. So I'm going to click that I do want to start the guide using Danny.
Benefit decisions can be tough, but don't worry, I am here to walk you through the options step by step. Start by telling me some information about yourself, then I'll give you a few suggestions on which plan options may be best for your personal situation.
So those of you who have not met Danny, this is Danny, our mascot here. There is audio associated with the guide as the member goes through. So I'm going to click let's continue that I do want the audio included.
Thank you for taking the time to complete the benefits guide. Before we get started, please tell me a little about yourself.
So Elizabeth is from Greenville, South Carolina. She has her household income in here. I'm going to click continue to get to the next page.
Eligible dependents are not listed below. Please click manage my dependents and then come back when you're ready.
Elizabeth does not have any dependents enrolled in the plan. Everything looks good. She's not planning on adding anyone. So I'm going to click continue to the next page.
Based on your age and gender, here's what you might need. Please adjust these as necessary.
So based on the zip code, it's giving me estimated cost calculators for each one of the line items of medical costs or any type of other services that I may incur throughout the year. So based on the South Carolina zip code that I inputted, the primary care estimated cost of the visit is $136. I can also go in and type how many times I'm expected to see my primary care for a sick visit outside of my annual physical. Same thing with the prescription drugs. It also breaks it down per tier, so I can see an estimated cost and how many prescriptions I would use per year. Also talks about urgent and emergency room services. Maybe I am going to expect to go to an urgent care at least once, so I will check that box. Other medical events are listed here. So if Elizabeth knew that she needed a cataract surgery, for example, she could indicate that here to give her the full picture of what she's going to spend on medical expenses throughout the year. Same thing on the dental and vision side. If she needed new glasses or contacts, she would indicate this here.
Okay, here are the health plans available to you this year. Let's review the key factors that contribute to your costs and find the one that best suits your needs. The first factor is the plan's annual premium, which will come out of your paycheck regardless of the care you use. Second, let's estimate your out-of-pocket costs under each plan based on the care you indicated you may need. I'll show you how you can reduce these by making smarter healthcare decisions later in the guide. Based on this estimate, you would be eligible for a reimbursement from your employer's HRA. Your employer will also help offset these costs by contributing to your health savings account. So if we add these up, we can see the annual total of each plan. I have highlighted the plan with the lowest overall cost. If you'd like more information, please click below. Otherwise, you can continue when ready.
So based on the information that Elizabeth input just on her expected medical costs, we have the two plans that are offered here, and it's going to highlight the one that I should be recommended in. I also love how the system breaks down what it's going to cost the employee per paycheck, has the annual premium here. If you're offering any type of medical expense reimbursement plan or HSA contribution, that's also factored into the net cost of the employee. If I wanted to compare the details, so I wasn't sure what the high deductible plan was versus the HSA plan, I could click compare plan details. And if I scroll down, it's a full benefit summary for me. So if I want to know how much it's going to cost me to go to a specialist, for example, everything is indicated here. So I'm going to hide the plan details. I'm going to add the HSA plan to my benefits.
Your employer offers a dental plan that can help you cover some of your expenses. Based on your dental needs, you may want to enroll in this benefit. Here's what your estimated cost would look like with and without this coverage.
So same thing for dental, just goes through my 3 options here, how much it's going to cost me per pay period, and then the estimated total cost per year. Vision as well would work the same way, where just walk me through what options make the most sense based on my specific needs. So that will really go through any of the plan options that I have. The next section is what I really like is just an education piece. Probably the questions that you get from a lot of employees when they have questions on what's an HSA. I'm sure they're coming into your office, asking you questions. They're looking on your intranet. This guide can walk them through why you should enroll in an HSA plan, or why would you receive services at an urgent care versus an ER. So there's a lot of tools in here that guide your employees to make the most cost-effective healthcare decisions. So I'll go through the HSA section just to show you exactly how it walks the employees through how this works and just educates them on an HSA. So looking at what's important to the employee, is it my take-home pay, reducing my tax liability, or saving for retirement? I'm going to say that saving for retirement is something that's important to me.
Now let's look at how you can make your dollars go even further.
It talks a little bit here about how the plan is HSA qualified. I can put aside dollars and pay for out-of-pocket costs tax-free. The money is mine, it never expires. I'm going to say that I don't have an HSA plan in place today. I'm going to click continue.
Let's talk for a minute about why contributing to an HSA is a good idea. First, each dollar you contribute is not subject to payroll taxes, which makes the money you spend on your health care go further. Second, any money you don't use will roll over, creating an emergency medical fund for years when you need it. Third, putting away more now can help you when you retire, as it will allow you to pay your Medicare premiums with tax-free dollars. If you participate in a 401k or a 403b plan, try to maximize any company matches first, and then contribute as much as you can to your HSA. Okay, let's look at this year's contribution. First, there is an annual limit on how much you can contribute. Your employer will help fund your HSA this year. It's always good to contribute enough to cover your estimated out-of-pocket costs, so let's start with this amount. You can also use your HSA to pay for dental and vision expenses, so I'll include these as well. I've estimated your tax benefits using your household income. You should put in more if you can.
This feature also highlights if you are giving a generous contribution to the HSA on behalf of the employees. It will outline this here. This sample is showing the $1,500 that the employer is giving towards the employee's HSA account. It will also break down the tax benefits down here at the bottom from a federal, state, payroll, and then the total.
Would you like to learn more about ways you can save on healthcare throughout the year?
So there are more features that the tool can take you through, finding low-cost prescriptions, using the urgent care versus the emergency room, as I mentioned. In the interest of time, I'm not going to take you through the full guide, but I do want to show you what it looks like from an employee standpoint as they are enrolling the benefits and just deciding what plan is right for them.
Okay, that's about it from me. I hope you found this experience enjoyable.
So the member here is given an action plan. It's recommending that I do enroll in the Cigna HSA plan, the core dental plan, the vision plan, and then open up an HSA account. If I decide that I want to enroll at this time, I can click continue to enrollment.
Great job. You made it through the benefits decision guide. Review the suggested options and start the official enrollment process.
Here's Danny again, just telling me what I should enroll in. So I have the recommended plans here. If I was currently enrolled in the plans, I could also see what I'm enrolled in today, and then my future enrollment, the recommendations here. So now I'm in the actual enrollment system. I have the medical plan. That's the first section that comes up. It does show me my two options that I went through in the decision support tool. On the high deductible plan, for example, it has a little blurb up to the left of what exactly the plan covers. I can see what's coming out of my paycheck per pay period for these benefits. As I was going through that decision support tool, it recommended that I enroll in the HSA plan. So that plan here is highlighted. And if I wanted to see some additional information on it, I can click view and compare plans. It would bring up the full plan summary. I'm going to decide that I am going to enroll in the HSA plan. It brings me to this page here. I'm going to enroll in the Cigna HSA plan. I'm not adding any dependents at this time. In regards to the health savings account, it's recommending that I contribute at least $78 to cover my medical expenses. I'm going to click yes. I would like to contribute towards my HSA. Say I'm going to contribute $2,000 annually. This will also show me the cost per pay period as well as the monthly cost. So I'm going to enroll in the HSA plan as well as the medical. The next section it brings me to is the dental plan. So same type of scenario as the medical. It's going to walk me through. I can see some additional information on the plan if I forgot exactly what's covered. My favorite feature of this tool is on the left-hand side here. There is a calculator. So as I'm going through, I can see what my actual spend is per pay period. So if I'm on a budget, I can see right now, currently I'm enrolled in the medical plan at $21.30 per pay period. The HSA is going to cost me $117.64 out of my paycheck, and the total that I'm currently paying is $138.94. So I'm going to bring you out of the enrollment system here. Another thing I just want to mention is that this is not just a tool for open enrollment. If I'm an employee, I have a change of life event, for example, I get married or have a baby, I can also come back in the system and make those changes here as well. So on the change of life event, I can start the event. I pick the event here. I can have everything verified. So if I had a baby and I was adding the baby to the plan, I would have to attach documentation proving that this is a valid qualifying event here. From an HR perspective too, the last thing I'll show you on the employee side is the compliance notices. So if you have your employee handbook, you have any type of HIPAA notices that you need to send out to the employees, from a compliance perspective, all of these documents can be housed on this site. So rather than having employees sign off on a physical handbook when they start, we can have all those compliance notices readily accessible to the employees. So that sums up the demo of the employee side. I'm now going to pass it to Terry just to show you the capabilities from an employer perspective on just some of the reporting and some of the other tools that we do offer.
Thank you, Ashley. So as I begin to share my screen, I just want to let you guys know I spent 2.5 years here at the Difference Card. And in that time as a data analyst, one of the things I did was handle your eligibility requests, entering your new enrollments into the system, as well as handling any of the qualifying life change events that Ashley mentioned. And this was from a manual standpoint. One of the things I often ended up assisting employers on was retroactively reconciling enrollment errors and kind of helping you with solving for billing discrepancies. Now, in current state, I run the account and renewal teams in the East region, and sometimes our consultants on the account team are often called upon to assist you with crediting an invoice due that happened because of an enrollment error, or reporting requests from our system for your plans that Many of you are probably having to compare to a report from a different system for your other benefit plans. With 7 years here at the difference card, a common denominator that I've often found is that you want a one-stop shop portal that will solve for some of the burdens and hassles you're experiencing, having to manually administer your plans, handle some of the reporting tasks and these enrollment changes or open enrollment duties that Ashley just showed you can be solved for from an employee side. I'm going to show you how this portal that we're going to look at benefits you from the employer side. So our portal for the benefit admin system is easy to access through a simple keystroke of credentials that are going to be provided to you, a username and password. You'll log in and you're going to be directed to a home dashboard that you're going to see present on your screen shortly. Now, on the home dashboard, you'll just be provided with generic demographic information about your plan offerings. Some of it's statistical and some of it's a little bit more detailed as we scroll through. You'll see detailed information about enrollment charts, generic information about enrollment counts, and percentage of the populations enrolled in different kinds of benefit plans, depending on the type, medical, dental, vision, ancillary benefits, you name it. In addition to that, you can kind of see logs, which is just, if we think about it, a history of recent changes, new hires, as we get that from your payroll integration to the system, as well as terminated or involuntary terminated events and the eligibility that flows from there. So this is just going to give you a high-level overview of the health and details of your benefit plan offering from this home dashboard screen. Now, one thing that I do want to note on the screen is you're going to see that on the screen, you'll have difference card administrator contact details. Whenever you have the benefit admin system with the difference card, you're going to have a dedicated account manager who's going to be available to assist you with any support you need navigating through or running tasks through the portal. And they're going to be able to have access to this portal should you need a live walkthrough on how to handle a specific task. One of the things I find very helpful is Zoom screen share, or if they just need to follow up on their end while you're on the phone to handle one of these simple tasks. Now, on the left-hand side is the navigation pane. And one of the things I like about the employer portal is that it's very simple and easy to navigate. You can accomplish a variety of tasks through the employer portal that can be summarized through communication to your employees, seeing generic and detailed information about your benefit plans, and handling some reporting tasks as well. And you'll see that that's nicely shown and displayed here on the navigation pane on the left-hand side of your screen. And it's going to be available whenever you're going within any given page within the portal. So if I'm going through searching for a member, this will still be there. If I'm on the home dashboard, this will still be there as well. And it makes it very easy for you to navigate through, and it's a hassle-free experience. Now, through the employer portal, one of the things that you're going to be able to do through this Ben admin system is be able to communicate through your employees. And you can do that before open enrollment, during open enrollment, post-open enrollment, as well as any key events that are happening within the lifespan of your plan period. Now, I did pay attention to the question we asked earlier, and it looks like a very small percentage of you are using a benefit admin system to communicate information to your employees. Most of you are relying on site to communicate that information or emails. And when we think about the state of open enrollment, if it's housed in a busy time, sometimes an email can be missed if it's a high volume workload. You can do communication through this portal and have an alternative method of communicating to your employees. Well, they'll have all the information on one page. While they're electing their benefits or going through the open enrollment process, they'll be able to view any important forms of documents from that same employee portal. So here you'll have the option to add forms, and you can add forms that are important policy documents or any other forms that members should be aware of. You'll have the option to categorize the form depending on which medical plan or plan the members enrolled in, as well as other subsets of status employees that they may be on, whether it's full-time or by location. You can also organize it that way. And when you add these forms to the employer portal, they're going to sync back over to the employee portal under that compliance section, and HR catalog that Ashley alluded to at the end of the presentation. And employers are going to be able to view that from their end on their portal and be able to reference when needed as they're making some crucial decisions that's going to affect the next 12 months of their life regarding the plan that they elect. Now, you'll also have the option to request with your account manager that you have a link added to the employee portal. And these links can be to your HR site or payroll site, or even to the carrier site for where the benefits are going to be elected to. So if you have a vision plan, dental plan, or medical, you can have a link that goes to that site. And all you have to do is just simply request it with your account manager. That will feed over to the employee site where they can click that link. And this can serve as that one Ben admin system that they're handling all their information into, as well as their change of life events, and connecting over to another website if needed. Now, another cool thing that you can do is see both general information and detailed information about your benefit plan offering. So under the benefits dropdown, you can see the networks of the different plans you have. If you're offering medical benefits, dental benefits, vision, or any other benefits, they're generally within certain networks. You'll be able to view the information regarding that. But the feature that I like a lot, and I think you'll find very helpful, is the detailed information that you can see about the benefit plans. Under the benefit plan section, you'll see some detailed information here that just starts with giving you the plan period. When does my medical plan run? It started on January 1st, 2022. It's going to end at the end of this year on December 31st. And I have 23 people enrolled in this HSA plan under Cigna and 18 people enrolled in this HDHP plan. Well, what if I want to see some additional information and I don't want to go over to my carrier site to see that? I want to just see that from this portal. Well, you can actually do that. By clicking the view option, you're able to see some very detailed information about each benefit plan, ranging from employee premium costs, medical plan benefit details. You can access the compliance document from the plan summary plan description, as well as see COBRA PE rates at the bottom of the screen as well. And I know that this is very helpful to see that from this portal alone, because sometimes you're often in current state probably asking your account manager or renewal consultant here at the difference card for that information. And with the Ben admin system, you'll now be able to log in and access that whenever you need. If it's late at night, you need to reference it. You don't have to wait till business hours. You can easily log into this portal and be able to access that as needed. Now, there are some reporting tasks that you can also conduct through the Ben admin portal. You can do custom reports. And what's very awesome about this tool is that you can actually set parameters around the report to get the desired information you need shown in the report that you're going to generate. Now, those are centered around who, plans, and output. Who do you want to see in the report? Do you want to include dependents? Do you want to include dependents that are on certain plans? Is it by birth date? You name it, you can set those customizations. You can then proceed on to plans where if you only want to see employees that are enrolled under your EPO medical plan or under specific plans, you can set that. And then you can set the desired output. Does this need to be a PDF report? Does this need to be Excel? You'll be able to set that and then generate that. In addition, you can also save the parameters that you set. So should you need to run a similar report in the future, you'll already have those definitions configured and you can run that report whenever you need. During open enrollment, in the middle of the plan, as it comes toward the future of enrollment, you can run that as needed. And I think that's extremely helpful because in current state, you're likely relying on your account manager right now to either walk you through a system to run that report or actually be able to send that report to you encrypted in a secure fashion. And now you'll be able to just click a button after going through a process once to run that report whenever you need to. The system also does have pre-configured reports that are standard for you. And some of the reports that I love to show you here are the open enrollment reports. This is very helpful because in present state, you probably are sometimes wondering if all your employees have already completed the enrollment process. Maybe you're tracking manual forms that are being completed and handed to you. Now you'll be able to just run a report during open enrollment that lets you know who has completed the process and who still has certain steps that need to take to complete that process. And then this ties back to the communication I showed you. You can then communicate to those employees as needed to ensure that they complete the steps that they need to go through open enrollment. There are also some other reports you can run, such as being able to see notifications that have gone out to new hires so that they can go through the employee portal on their end to complete that special enrollment process that Ashley showed you on the employee portal and take advantage of that Danny decision support tool. Now, one of the things that's going to be awesome about the benefit admin system is knowing that with an integration with your payroll vendor, a lot of your eligibility changes from adding new employees to qualifying life events are going to be communicated autonomously through a connected integration. And you'll no longer have to manually handle those tasks. But I do understand that there are sometimes time-sensitive situations that arise where you may want to get an employee started as early as possible. One situation I can imagine, if it's an employee you may have hired at the end of the month and their benefits are to take effect at the beginning of the month, it's only about 3 days away. You may want to start getting the ball rolling. And so you can click this add employee feature, you'll be able to start manually inputting the employee information into the system. And then when it comes over from your payroll vendor, it'll just match up and the process has already started. Now, we don't expect that you'll need to use that often because you're going to be enjoying the passive benefits of having this handled for you hassle-free through the integration with the benefits admin system. In addition, if ever needed, you can secure upload documents, such as if a qualifying life event documentation needed to be uploaded to an employee record, you can handle that through the system whenever you need. But also important is if you needed to ever search a specific member's profile to see benefit elections or premium contributions, you can do that. And that's available both here on this helpful navigation pane, as well as in the top right hand of your screen, and that's available no matter what screen you're on. So if you notice, if I'm back here on the network page, you'll see that that's there as well. And if I go back to the home dashboard, that's there as well. So it's very easy portal to navigate. There are rich benefits that would be provided through the benefit admin system. Given my prior experience here, I'm a huge advocate of it. I would really love to be able to speak to some of you further about it. But in the meantime, I'm going to turn it over to Chris Calderon, who's going to talk pricing and product details.
All right, thanks a lot, Terry, and great job there, Ashley and Terry, showing off all the features of Danny, the portal, and that administrative component of it. Really some great features to share. So now we're going to walk through the product pricing and details. All right, so many of you may have already known the difference card for our cost containment solutions. That's what I'd say we're best known for in the market. The difference card medical expense reimbursement plan solution, the guaranteed savings component that we wrap around many of our plans, and the wellness integration as well. We also have a full list of benefit administration tools and services for our customers, things like HSAs, HRAs, FSAs, commuter, a self-funded dental program. What we're really focused on today is the COBRA administration and the online enrollment platform, which is the integrated solution we have been alluding to. So included in this solution, we do all of the build out of the plans. And I know that was one of the questions that came up in the chat. We work very closely with the broker partner to make sure we've got the right carrier information and all the data, but we will handle all of that system build out. We'll connect to your payroll vendor. We'll send the data back to all of your carriers. So all that development work and heavy lifting is handled. We'll do the COBRA notifications, the online enrollment system, continuous enrollment. The ongoing maintenance of this is also included in the pricing here. And it's a flat rate of $5 per employee per month. We don't charge a setup fee for the system. And one of the other key differentiators is that we don't charge separate carrier integration fees. It's just $5 per employee per month, flat fee. Again, no setup fees, no additional payroll connection or carrier connection fees. And that includes everything: COBRA administration, online enrollment, all the development, build out, and the ongoing service of the system. Now, many of you may be asking, well, all right, this sounds great. I love the online enrollment platform. I want to use the Danny decision support tool, but I already have a COBRA vendor that I'm happy with. And that's okay. We are allowing the system components to be taken apart. I do believe it works really well together. That automation, the end-to-end experience is ideal, but we recognize that some of our customers may want to take pieces of this. So $3 PEPM is the online enrollment platform. And then the enhanced COBRA component is that automation and the connection of doing all the COBRA administration, the notifications, the collection of premiums, the communication with the carriers. That's the extra $2 for the enhanced COBRA. So that's how we get to that combined $5 PEPM. There is also the ability just to take the COBRA portal side of this. So if you wanted to just basically fulfill your COBRA regulation needs and have the administration handled, that's a $1 PEPM charge, but that does not include the file feeds or the automation. So again, the most basic service here is classic COBRA at $1 PEPM. Enhanced includes the file feeds and the automation, that's $2. $3 for the online enrollment platform. So all in here, $5 PEPM is the integrated system cost. Enhanced COBRA, I alluded to this, but this includes the initial notice, termination notices, all of the open enrollment support every year, the billing of premiums, collection of premiums, remittance, so that you can pay those bills. That's all included in that enhanced COBRA solution. If you wanted to just focus on classic COBRA, again, most basic offering, you're going to have to manually make the changes. So that's different than what we've been showcasing today, but just want to explain that that is an option. And that does include the termination notices, open enrollment, billing, and collections as well. So that is available at the most basic price here of $1 PEPM. From an implementation perspective, again, a lot of questions about who does what. We do need you to tell us some information about your company. So clarify who's in which class, what are the different waiting periods, and we've got an intake form to make sure we get all of that right. And we work very closely with the broker on the account to make sure we've got the carrier connections, and we want to do a review of the employee portal and homepage to make sure we get everyone sign off before we go live. And then from there, we do all the work of building the portals, connecting to the payroll vendor and the carrier, testing it, and communicating this out with employees on an ongoing basis. From a timeline perspective, I think it's important to understand some of the timing of this. The actual build out of the portal and getting that off the ground can happen in a couple of weeks. So that's fairly quick. But if you are doing the payroll integration, the carrier integration, that can extend it out a couple of weeks. We want to make sure there's time to test the homepage, time to integrate the COBRA module. And there are additional modules like ACA reporting that can be weaved into this. So you want to leave enough time to do this. If you're a 1-1 group, this is a great time of year to start thinking about it, maybe doing a personalized demo, starting to collect the information so that we're ready to go well before we get to your open enrollment cycle. Terry did a great job alluding to it, but you still get the great support that you've been used to with the difference card, your sales team, your renewal team, the account management team. And in addition, there's a benefit admin specialist designated to helping with this system, helping us build out the implementation and the ongoing support of this system. So there's additional resources that you get from a technology and service perspective with this solution. So finally, are you interested in a proposal for the Ben admin system? The pricing is fairly standard. We went through it, but if you want a detailed customized proposal for your group, we'd love to show it off to you. You can click this proposal button when we send this around after, or email us at sales@differencecard.com. I would also encourage you to talk to your difference card representative. If you're a broker, talk to the senior consultant that's assigned to your agency. If you're an employer group, talk to your account representative, your account manager, or your renewal consultant. And we would love to do a personalized demo, walk you through the system, and talk about exactly how it may work for your company. All right, we've gotten a lot of good questions in the Q&A here, so maybe we'll just review a couple of these together before we end. Looks like we've got 5 or 10 minutes or so here before we end. So just a couple of the questions that have come in so far. Debbie had one about how does this affect existing carrier connections? If you've got carrier connections in place, that's great, right? We don't want to interrupt any of them, but you may want to use this as a single source of truth. A lot of our customers do want to use this as the single source of truth, and then we will do the connections with the carriers for you. there were some good questions about the decision support tool. It does customize for your specific plan. So if you've got a copay plan, it's going to recognize that. And when it gives that out-of-pocket maximum estimator that Ashley showed off, it'll be specific to the copays or deductibles associated with your specific plan. We do the build out of this, so that is all handled. We're going to ask some questions. There's going to be a meeting to intake some information, but then we handle the build out and the development of this whole system. And then there was a great question about, well, what are the different vendors that you connect with? What about these carriers or these payroll vendors? So there are definitely a long list of carriers that we are already connected to, and payroll vendors as well. But we're open to connecting to any carrier or payroll vendor that will exchange data with us. So that's already established. And there are some size restrictions. Some carriers will not do these EDI file feeds at a certain size threshold. So that can be like under 100 lives. You might not be able to do file feeds with every carrier, but in certain markets, certain carriers, they do it at smaller sizes. So definitely something we would talk through in the individualized proposal discussions. All right, we got a few more. Terry, Taylor, Ashley, anything else that you all want to address that I missed?
Yeah, Chris, we have had some interest in talking about the technology, like how was the system built? A lot of people would like to know like how we got this up to speed so quickly.
Yeah, so we've got a great technology team at the Difference Card, and it's led by Dan Mashapinto, who's our Chief Technology Officer. He's worked very closely with another technology vendor behind the scenes, and they've been one that we've worked with for over 10 years. We have a lot of mutual customers with them. We partnered with them to make sure that we rolled out the system in a smooth way. And we know it works because we've got a lot of existing customers already on that platform.
Great. And this is kind of like in line with the question that Nancy asked, like, do we have some current clients that are using this plan and would they be willing to talk about their experience with the Difference Card? And Nancy, I'm going to send around, we did a case study recently on one of our clients that does use this platform, and it's got some good information there, but Chris, I'll let you kind of further go into detail on that.
Yeah, more than happy to share client references. That's a great way to learn more about this, get the experience of those customers. So great idea, Taylor, to share the case study, and reach out to us if you want to learn more. And we can definitely go down the reference path as well to introduce you to another customer already using it. Frank's got a good.
Yes, I was going to say that one. Go ahead, Chris.
Yeah, Frank's got a good question here about size of the groups that we will work with. And Frank, generally Difference Card's working with customers with 20 employees or more on the plan, but this actually can be decoupled from the Difference Card. So this is a standalone offering, although it works really well when it's all put together. And there really are no size restrictions, but generally under 100 lives, it's tougher to get some of the file feeds in place. If we can do the Ben admin system, that's a great integrated solution for really a group of any size. The enhanced COBRA piece I talked about, that's generally for groups over 100 lives. Classic COBRA is under 100, but if we're doing everything together, that can be done for any size group. And again, typically 20 employees or more is what we're seeing, but happy to work on any opportunity you may have, Frank.
And just last question here, Chris, we've got a lot of interest in like, how do we, like, what are next steps? Like we've got some people that want to see demos, maybe they weren't on this call, but they're the tech person for their organization and they need to kind of dig into the nuts and bolts of the system. What's the best way, aside from submitting an RFP, that these people can get in touch and get this scheduled?
Yeah, great question. And after we did our broker webinar last month, we got a lot of those inquiries, and we've been doing a lot of these vetting discussions with the technology experts at certain agencies. We've gone through a lot of successful meetings so far. So reach out to sales@differencecard.com if you don't have a direct contact already, and we will help you to coordinate that meeting. If you do have a contact, if you know who your account manager is or your senior consultant, if you're an existing customer, definitely reach out to them as your main point of contact, and they will help to coordinate with our technology specialists and get this all live and demoed for you.